Remote healthcare services, or telehealth, is a recent trend that is becoming more and more widely adopted. In the article, there are many reasons cited for not having fully adopted the technology yet, with some being technical constraints on the healthcare organization's end, all the way to limitations on the patient's end. In my opinion, I think that technical limitations might be an initial issue that will eventually become less of a limitation. I think the largest limitation is adoption by the patients. I think there are some people that would be willing to quickly adopt the technology, but an older subset of the population would be hesitant to do the virtual meetings with their doctors, which is often the people that need the most monitoring and quality care. I think transitioning heavily to virtual care would affect the quality and frequency of care that older people receive.
Exploring the potential for technology to improve cystic fibrosis care provision, patient and professional perspectives, is a paper written by Sunil Roger and Kenton O'Hara in order to explore how technologies can be implemented into home-style care for cystic fibrosis. This paper, however, has broader implications in adding home care to all clinical care so that chronically diseased patients can have chronic care given to them as well. They cite other researchers' work in exploring how in-home care methods mesh into hospital care and how to further fuse constant care into the common man's life. Overall, this paper does a good job of clearing up the details in patient and clinical care and further elucidating the thoughts of the market and patients and physicians on chronic care.
A method used in order to understand the experiences of cystic fibrosis treatment and care from both the professional perspective but also that of the patient is taking a grounded theory approach. Grounded theory derives conclusions from an iterative process of data collection. However, the team used a constructivist approach so as not to generalize nor universalize any conclusions derived from their grounded theory method. Over 3 days, the team observed the cystic fibrosis care between the MDT and the patient. Patients would then account for their behaviors during these exchanges. Handwritten field notes from in situ conversations with the MDTs also provided concepts that guided their grounded theory approach of ongoing analysis. They conducted 18 interviews ranging from an hour long. These interviews allowed for patients and professionals to give further notes, concerns, observations from what was previously noted during the team's observation.
So I'll be discussing the results of the cystic fibrosis study, looking at how patients accommodate CF in everyday life. It can take a super rigorous schedule of ensuring medications are taken properly and can be really hard to manage on top of other obligations. A lot of patients will use mobile phones or other wearables and trackers in order to remind themselves to take their medication or to track things like exercise, which is super important to some. Looking at the challenges and burdens of clinic attendance, there can be a long wait, a long travel time, they'll have to take time off of work or away from family, and then also just that patients can only give the doctor a very small idea of what's going on in the context of the rest of their life. So looking at technology in the future of CF care, the goal is to really use remote monitoring to improve timeliness and reduce the burden of care. And so doing this by using wearables and home spirometry that might allow patients and the multidisciplinary team to overcome the challenge of the very small snapshot you get when patients come into clinics. And then also using things like remote triage and remote clinics, which would be video calls with CF specialists used prior to regular appointments in order to see if a patient is stable and well enough to stay home. And so a lot of patients were really excited about the idea of technologies that could help reduce their time in the hospital.
Hello, my name is Joshua Yu, and I'll be talking about the limitations of exploring the potential for technology to improve cystic fibrosis care provision. There are many beneficial factors that coincide with improving cystic fibrosis care provision using technology. However, the limitations are just as noticeable. For example, there have been great results that come from research, but the findings are not easy to relate to all the patients who do suffer from cystic fibrosis in the world. It is also hard to generalize findings to clinical teams in all cultural or healthcare contexts. In conclusion, there are certain criteria that need to be considered when designing technologies for collaboration in chronic health conditions, such as cystic fibrosis. I think that technology has come a long way and can be an important function to improve healthcare systems that support patients who suffer from CF. For technologies to support self care and the wider activity system of chronic health care provision, to be successful in chronic conditions such as cystic fibrosis, these healthcare systems must be well integrated and grounded in the lives of people living with those conditions.